innovative management approach to ketosis treatment using once per day milking as an agent, or no?
Adjunct.
Thank you. Treatment of hyperketomia. Please.
Good afternoon, everyone. As he stated, I'm Maggie Williamson from the University of Guelph, and I will be sharing my findings of my research that examined using once per day milking as an adjunct treatment of hyperketonemia. We know that ketosis is a metabolic disease marked by elevated concentrations of ketone bodies in the blood occurring in early lactation, and ketosis is normally diagnosed at a blood BHB concentration of 1.2 millimoles per liter or greater. Ketosis negatively affects cow productivity and profitability, and it's associated with a decreased health, milk yield, and fertility, which also tends to lead to a greater risk of other illnesses, and it's also associated with an increased culling risk. Research in the area of ketosis is important because subclinical ketosis affects approximately 40% of the lactations in North America, and there tends to be very extensive variation of almond farm incidence ranging from approximately 30% all the way up to 80%. The current best treatment options for ketosis only resolve the disease approximately 50% of the time, and virtually all treatments in the last 50 years have focused on providing cows with more energy. We know that ketosis is caused by an imbalance of energy input and output, so our question is, can a temporary reduction in energy demand reduce metabolic challenge and more effectively resolve ketosis? Most research that examines a reduced milking frequency focus on production impacts as well as prevention of disease. Milk losses range from 15 to 40% in short-term early lactation studies, and there tends to be a higher somatic cell count in cows on reduced milking frequency. We also know that once-a-day milking provides improved energy balance in cows even while they are in a feed deficit compared to cows milked twice per day. And this includes a lower NEFA and BHB concentration, as well as higher plasma glucose. There still hasn't been any research examining the effect of once daily milking on ketosis resolution, though. So for our study, our objective was to examine the effect of decreasing milking frequency from 2 milkings per day to 1 milking per day for 2 weeks in conjunction with the standard treatment of 5 days of oral propylene glycol in cows diagnosed with ketosis. And the major outcomes that we were focusing on were ketosis resolution and milk production. This study was a randomized control trial performed at the University of Guelph Livestock Research Innovation Center, and it lasted from November 2016 to September 2017. All cows were milked in a de Laval VMS robot equipped with herd navigator. Starting at 3 days of milk, cows were tested daily for ketosis in the morning, up to a maximum of 16 days of milk, where if that cow did not have ketosis by that day, she simply left the screening process. We define ketosis as a blood BHB concentration of 1.2 millimoles per liter or greater, and the first ketotic test that we found would enroll a cow onto the trial. All ketotic cows were given 300 milliliters of propylene glycol orally for 5 consecutive days, starting on the afternoon of the ketosis diagnosis. All cows were also randomly allocated to a treatment group of either once per day milking or twice per day milking. We allocated heifers separately to treatment just to ensure that we had an equal representation of heifers in both treatment groups. Ketotic cows were BHB tested for the first 3 days of trial, and then they were tested once every 3 days for 3 weeks. Milking frequency was returned to twice per day on day 15 of trial for the once per day cows. So you can see from this chart here, we just have X's on every day where cows were sampled pertaining to the day of trial, and the red arrow just signifies when the once per day cows return to a twice daily milking frequency. Milk production, milk components, and somatic cell count were collected weekly for 15 weeks through CanWest DHI, and we also collected data on disease occurrence up to 60 days in milk and reproductive performance. We ended up enrolling 104 ketotic cows onto our trial. 55 of these cows were once per day, 21 of them were heifers, and 34 were cows, and 49 cows were in the twice per day group, with 18 being heifers and 31 cows. 6 cows had to leave trial early within the first week. 4 of those cows were in the once per day group, and 2 were in the twice per day. So first we'll look at our results from the Ketosis Resolution. We ran our ketosis data through a binary logistic regression and in SAS 9.4. So this graph is showing the proportion of first lactation animals, or heifers, with ketosis in both treatment groups. So the orange line is showing the proportion of once per day cows with ketosis, and the green line shows the twice per day cows. So as an example, on the 6th day of trial, 32% of the cows milked twice per day had ketosis, while practically 0% of the animals in the once per day treatment group had ketosis. And we observed a significant treatment effect in this model from day 2 to day 18 of trial. This graph is looking at the treatment effect on all primiparous cows, or second plus lactation animals. And once again, for example, on the 6th day of trial, 60% of the animals in the twice per day milking group had ketosis, while 27% of our cows in the once per day milking group had ketosis. So that's a very big difference, more than 30%. Next, we looked at our milk production and components. We did not see an overall treatment effect on milk production, but these red dots signify weeks where we did see a treatment effect with a significant value. So this is just the first lactation animals, and we can see that overall, the two trend lines, the once per day cows do trend to produce less milk over this 15-week period. And we can see this similarly with the twice per day the second lactation cows, where the once per day cows are still trending to produce less, as well as our third plus lactation cows. We observed this same effect. We also examined the 305 milk yield for all cows that remained in the herd over 200 days in milk. We examined this with just the 305 milk alone. As well, in a separate model, we incorporated the 305 milk from the previous lactation for any cows in their second plus lactation as a possible explanatory variable. But in both cases, we did not observe any treatment effect. For fat and protein percent, we also did not observe any differences, but for linear score, we found that once per day milked cows had a mean linear score 0.58 points greater than twice per day cows. From this study, we can conclude that reducing milking frequency from twice per day to once per day in conjunction with propylene glycol is more effective at treating ketosis than treating cows with propylene glycol alone. We also know that reducing milking frequency for 2 weeks in early lactation cows with ketosis may have a negative effect on milk production overall. We would like for future research to explore shortening this reduced milking frequency period. From the graphs, we can see that by day 6, most cows that are going to resolve their ketosis have already resolved the disease. So it'd be very interesting to shorten that period to maybe 5 days to make it simpler for farmers to understand. And not understand, just keep track of. And we would just like to know, if we do this, would ketosis resolution remain the same, and would milk production be affected in the same way as this trial found? And that's all. Thank you very much.